Hello, it's Dr. Rhonda Johnson. Today is Monday, August 15th, 2022. A number of viewers have asked me to review the updated CDC COVID guidelines, so I'm going to try to simplify this and do it quickly. Now, on Thursday, August 11th, the CDC issued updated guidance. You can find all of the updated guidance in the August 11th issue of the CDC publication called the Morbidity Mortality Weekly Report. It's available online. Now, this article published again directed guidance to individual persons, communities, and healthcare systems, but I'm only addressing guidance for individual people with one exception when it comes to schools. I'll just tell you what that is right now. The CDC is no longer recommending test-to-stay programs for schools because they say it's resource intensive. So the rest of my discussion is for individual people like myself and you. So here's what the CDC, they have 4 broad categories for preventing serious COVID infection. They're focusing on prevention of severe disease. Now, they say people should know their individual personal risk for severe illness and use that knowledge to choose preventive behaviors to protect themselves and those around them. Number 2, protect yourself with vaccines and boosters. You can minimize your exposure risk through non-pharmaceutical interventions such as hand washing and personal distancing, improving ventilation and use of masks or respirators indoors, and of course testing. The CDC says take action if you're exposed, get tested and wear a mask, and take action if you're sick or positive. Isolate, seek medical care, and if you're eligible, antiviral therapy. Now, what else did they say for guidelines for individual people? Number 1, the recommendations are the same for unvaccinated and vaccinated people. 2, they're no longer recommending testing people who don't have symptoms and without known exposure. 3, they still recommend physical distancing, but mostly for people at high risk for severe illness. And they say these high-risk folks can avoid crowded areas and minimize direct physical contact. Yes, they still recommend hand hygiene, that you wash or sanitize hands frequently. Now, if you are exposed to someone with COVID, they no longer recommend quarantining when you are exposed to someone with COVID. CDC says you can wear a mask for 10 days and test on day 5. Now, that's different. Now, if the other recommendation I want to go into is symptomatic. If you have symptoms and you think you have COVID, CDC says you should isolate if you are sick. But if your results are negative, you can end your isolation. Now, this is where many doctors disagree. They want to have you repeat your tests several times. But the CDC says you can end your isolation if you test negative. Now, if you test positive, the recommendations are still the same. Stay home for at least 5 days. Isolate from others in your home if you're positive for COVID. Wear a high-quality mask when you have to be around others at home and in public through day 10. Now, in terms of ending isolation after day 5, the CDC says if you're fever-free for 24 hours and you're not using medication to cut your fever, if your symptoms are improving, or if you never had symptoms but you tested positive, you can end isolation after day 5. CDC also says, regardless of when you end isolation, avoid being around people who are more likely to get very sick from COVID until at least day 11. That acknowledges the fact that some people are still going to be positive at day 5. For people who have moderate COVID disease or have a weakened immune system or who have been hospitalized, the CDC says you should isolate for at least 10 days. Consult your doctor because you may have to isolate longer than 10 days. Now, after you have ended isolation, if your COVID symptoms return, worsen, CDC says restart your isolation at day 0 and talk to a healthcare provider if you have symptoms or questions. Now, regarding that test to end isolation, CDC says if you have access to those rapid tests and you choose to do testing to determine when you can come out of isolation, wait until day 6 to take your first test. And make sure you don't have a fever for more than 24 hours without the use of medication, and all your symptoms have improved. So they say test 2 days apart. So you test on day 6 and you test on day 8. And if both tests are negative, you can end isolation. I know this is a long message, but I'm trying to respond to the question that I was asked. These are the CDC recommendations, the updated guidelines for individuals. And again, I'll include the link to the MMWR for those who want additional information. I hope that helps. This is Dr. Rhonda Johnson. Be well. Take care.